Hi, everybody. So today I'm going to be talking about central auditory processing disorders, what it is, how you go about testing for it, who should go about testing for it. And one thing that I really wanted to highlight is that when I was in audiology school, talking about auditory processing disorders was a bit of a controversial thing. The reason being that there are those in the profession who think that auditory processing disorders are real, but maybe they can't be tested for reliably. And then there are those who think that you can test for it, but you can't treat it reliably. And then there are those who think that you can treat it, you can test for it, and you can treat it. And then, of course, there are those who think that auditory processing disorders aren't even real and they're just a ruse. And all of those thoughts are valid. I'm definitely of the camp of people who think that auditory processing disorders can be treated and it can be tested for. It is true, however, that there is not a gold reference standard for practice when it comes to assessing and treating auditory processing disorders. And what this means is that there is not a single test item, test battery, or intervention that has shown to be the best at reliably and repeatably identifying and improving outcomes for individuals who have this disorder. The result is that a lot of different assessments and approaches to treatment exist, and audiologists are sort of at their leisure to pick and choose what they want to use based off of their own clinical experiences. And so despite this wide open pattern of practice, you could say there are key practice guidelines that are accepted as important components, at least in the identification of an auditory processing disorder. The first is ruling out peripheral hearing loss. As a rule of logic, hearing loss is itself an auditory processing disorder. However, when we're talking of auditory processing disorders, usually people are talking about what the brain is doing with the sounds it can hear, not about how the structures of the hearing system are able to conduct sound to the brain. Hence, when referring to auditory processing disorders, I often include the term central to indicate that I am referencing the brain and its ability to make meaning of what gets to it, auditorily speaking. So ruling out hearing loss is important because if hearing loss does exist, we would want to intervene that before assuming that there is something different about how the brain is able to process sounds. Of course, once hearing loss is intervened by amplification technology, if that's what the patient chooses, taking the time to understand the central processing of auditory stimuli is just as appropriate, and further intervention may be necessary for the patient to optimize how they make use of what they do hear. So when assessing for auditory processing disorders, the goal is to look at the whole auditory system, which is rather complex. We hear with our brain, not just the ears, which is a very cliche yet true phrase you might hear audiologists say quite a bit. Auditory processing, therefore, includes all sorts of elements, including the brain's ability to tell whether sounds are coming at the same time or not, even by mere milliseconds, which is pretty cool. The brain's ability to tell if a sound is perceived softer in one ear over the other. The brain's ability to retain auditory information and recall it in the short and long term. And the brain's ability to detect and process target speech from non-target speech or other environmental noises. And of course, the brain's ability to discriminate the sounds it hears, and synthesize it all together to make meaning. That is a lot of neurological effort, yet our brains are able to develop these abilities very early on in life. So when there's a delay or a deficit in any of these auditory processing pieces, individuals may struggle socially, academically, emotionally, and even vocationally. I have a patient right now, she's 16 years old, has an auditory processing disorder. She's getting her first job, but she's struggling horribly. It's sad, actually, because she's working in a restaurant and her whole job relies on her ability to listen and understand what people are saying. and she enjoys her job, she enjoys her colleagues, she enjoys what she can do, but it's really difficult for her to understand what people are saying. So you can see how this can really impact you beyond just, talking with your friends during lunch. Auditory processing disorders is a silent disorder that is difficult for others to understand, especially when hearing loss is not involved. I myself have worked with many other providers, including audiologists, who have been very dismissive of auditory processing disorder assessments when the audiogram, which is the little graph the audiologists use to plot hearing sensitivity, when that's normal, people can be really dismissive about the auditory processing disorder exam. Yet I have also worked with students who have consistently passed peripheral hearing exams, who cannot follow multi-step instructions, who ask for repetitions so much it infuriates the teachers and the parents, whose eyes gloss over after only 5 minutes of listening because the burdens of listening and understanding are so extreme that they simply stop listening and they escape into the parts of their perfect little minds that don't need to attend to what they're hearing. The model we follow here at Little Heroes Pediatric Hearing Clinic for both testing and treating auditory processing disorders is called the Buffalo model, which was created by Dr. Jack Katz. And he is known to be a leading expert in auditory processing disorders. This model focuses on understanding what the brain does with what it hears and can tap into each of those auditory processing functions explained earlier. From the test battery, we approach intervention with the idea to help the brain practice doing what the testing shows it might not be doing efficiently. For example, one of the most common deficits shown in auditory processing disorders testing at our clinic is called decoding, which is a deficit processing speech as quickly as other people at the phonemic level, meaning we know from their audiogram that they can detect speech. We know that they can hear speech because they can hear soft speech because their audiogram is normal. But what we don't understand is, can they hear b and know that to be a B rather than some other sound in spoken language? So we practice helping them learn to discriminate those sounds. We present a speech sound in isolation and then in the context of words, and help our patients learn the difference between, for that same example, between p and b. Okay, in this way, if one says, put the box back in the pile of packing material, our patients hear and understand that instead of hearing, put the box back in the pile of packing material and feeling confused or needing to work harder at understanding and using the context to make meaning of what was just said. One of the key interventions we provide here has to do with modifying our patient's listening environment through technology. For us, that means low-gain hearing aids coupled with a remote microphone. Low-gain hearing aids are simply hearing aids that are programmed to enhance speech clarity, especially in noise. Unlike hearing aids that we program for children who are deaf or hard of hearing, where the main purpose there is to give them access to sounds, our patients with auditory processing disorders already have access to those sounds. We just want to give them a little bit of oomph. And again, coupled with that remote microphone technology, will help our patients understand their primary communicators' voices just a bit more clearly, especially in those noisy listening environments such as the classroom. So auditory processing disorders can be emotionally exhausting for both patients and their families, their teachers, which is why we are so passionate about advocating for the need to diagnose and treat auditory processing disorders. I cannot say how many times parents come to my office and end up in tears explaining that they have been tested repeatedly by school personnel and even by other audiologists saying that their children are just fine, when the parents know in their hearts that there is something different with how their child is able to respond to sounds. And here at Little Heroes Pediatric Hearing Clinic, we consider parents as the partners in expertise. We take your concerns seriously, and we won't let you leave clinic until we have a plan of action that meets your needs. So if you have any questions about auditory processing disorders, please feel free to make a comment below. Like and subscribe to our channel so that you can see more content when it comes out. We're big believers here at Little Heroes that children do suffer from hearing hearing differences that go beyond the typical thoughts of what hearing differences can look like, and that includes auditory processing disorders. We're here to support you. Please reach out with any questions or comments you may have. Bye.